Here's a chronic granulomatous disease, CGD, USMLE style question for you. A 6-year-old boy with a history of recurrent bacterial infections presents to the clinic with a new episode of pneumonia. He has had multiple prior infections, including abscesses, pneumonia, and skin infections caused by Staphylococcus aureus, Serratia marcescens, and Burkholderia cepacia. His medical history includes chronic granulomatous disease, CGD, diagnosed at age 2, and a family history of X-linked inheritance. Laboratory tests show a defective oxidative burst in his neutrophils. Which of the following organisms is most likely to cause recurrent infections in this patient? A. Streptococcus pneumonia. B. Escherichia coli. C. Serratia marcescens. D. Haemophilus influenza. E. Neisseria gonorrhea. Answer and explanation. The correct answer is C. Serratia marcescens. Chronic granulomatous disease, CGD, is an immunodeficiency disorder caused by a defect in the NADPH oxycomplex, resulting in impaired production of reactive oxygen species, aureus, by neutrophils. This defect leads to an increased susceptibility to infections, particularly with Catalase Positive organisms such as Staphylococcus aureus, Serratia marcescens, and Burkholderia cepacia, which are more difficult to clear in CGD due to the inability of neutrophils to produce reactive oxygen species to kill these pathogens. Serratia marcescens, in particular, is a catalase positive organism that is commonly implicated in recurrent infections in CGD patients. The other organisms listed are less commonly associated with CGD. Streptococcus pneumonia and Haemophilus influenzae are more typically associated with immunodeficiencies related to B-cell dysfunction or complement deficiencies. Escherichia coli is a common cause of infections in individuals with complement deficiencies, but is not typically associated with CGD. Neisseria gonorrhea is more likely to cause infections in patients with defective complement rather than CGD. Key takeaway: patients with chronic granulomatous disease, CGD, are particularly susceptible to infections with catalase-positive organisms, including Serratia marcescens, Staphylococcus aureus, and Burkholderia cepacia, due to impaired neutrophil function. Let me know if you need further clarification.